Um, all right. Nohumai herimai, tena koutou katoa, na mihi nui kia koutou katoa. Warm greetings, everyone who is joining us here in New Zealand and also across the globe. It's nice to see so many different faces and names. It's a pleasure to welcome you to our lecture of Gayle Souter Brown as part of our Thinkers and Doers lecture series. My name is Bruno Marquez, and I'm the Program Director for the Landscape Architecture Program at Te Rangawaka, Victoria University of Wellington. For some of you that have been attending our lecture series in the past, Thinkers and Doers aims at bringing together practitioners, scholars, students, and the wider community of landscape architects and affiliated design professions to share ideas and to hear the latest innovations in the field, especially in this time of international pandemic. So this is an initiative between the New Zealand Institute of Landscape Architects, our Wellington branch, and the Landscape Architecture Program at Victoria University of Wellington. Our sixth speaker, Gayle Souter Brown, is a health and well-being consultant, sustainably connecting young and old back to nature. She uses collective storytelling and community involvement in the design process to boost community health and workplace well-being. She's the founder of Greenstone Design UK in 2006, and she expanded to New Zealand in 2012. Her practice takes a collaborative co-design approach and focus on urban ecology, mental health, occupational therapy, and education of professionals that all come under the same umbrella. You may also recognize her. She's the author of Landscape and Urban Design for Health and Wellbeing from Routledge in 2014. And she's also a member of the International Federation of Landscape Architects Advisory Circle since 2017. She's also known locally and internationally for making the complex seem simple, and her research and global practice aid projects at a variety of scales in housing, leisure, education, health, and business. So her lecture will be looking at a very topical situation that we are all facing, the post-COVID and our recession in economy, where designers will be expected to add value to communities and environments in new ways. Health promotion to ensure the public immune system is as strong as possible can be achieved through design. And design can be a powerful tool in shaping behavior and change. So according to Gayle, the devil, as always, is in the detail. Some just very briefly housekeeping rules. So Gayle will be sharing her screen. So keep this window open so you can see the slides. Please remain muted throughout the talk to avoid any background noise. And at the end, there will be plenty of time for questions. You can either ask them verbally or write them on a text on the chat box. So please join me to give a very warm welcome to Gayle, all the way from Auckland.
Kia ora, everybody, and thank you, Bruno. I will share my screen here. Hang on. No, I don't think I've done that yet. Here we go. Let's try this one again. Okay, so hopefully you can now see what I'm seeing. And I thought when Bruno invited me to talk to you this morning, in this post-COVID world, I thought rather than sort of giving a lecture per se, that a reflection on research and practice, what we've been doing at Greenstone Design over the last, well, 30 years, I guess, in total, might sort of be of interest. So I've just finished PhD looking at the effect of landscape design and health within a very structured health framework. So all the images on the slides are chosen for a reason. So remember this one. This is the beginning. So here we go. So sheep in a field, heading uphill. And that's what it feels like often, that it's an uphill journey and you've got somebody leading out the front and then the rest follow. So this is what we're aiming for. So urban landscapes around the world are remarkably similar. They share many similar features. So they are managed, like the image on the left, to be low care, low maintenance, but are fairly sterile environments. So yes, they've got grass, yes, they've got trees, yes, it qualifies as green space, as open space, but they don't do much more than provide that tree and that grass area. The image on the right is another very common example, that ubiquitous urban plaza that has formal structural planting, it's got fixed seating, it's there, and it's an architectural statement. But again, it doesn't do much other than have somewhere to sit and some trees. So more on that shortly. So given that this was my start point, this was what we're all familiar with, as a design practice, very early on, we said, okay, what's going to be our point of difference in a crowded market effectively? And having a family full of healthcare professionals, from GPs to consultants across the huge range of disciplines, I was interested in health from an early age, and mental health well-being as that affects physical health. And I thought, how can I turn my interest, my passion for trees, for the environment, for people, into something that became a targeted, effective tool? So why our raison d'etre as such is all around stress. Stress impacts well-being. And so the photo here of this chap sleeping is in the middle of his workplace. And what we did in this particular workspace was create a space where people could come, rest and restore. And he felt sufficiently safe to be able to sleep in view of his boss, which took some doing. But lifestyle-related diseases, so some cancers, heart disease, depression, anxiety, obesity, are all linked with stress. So what I know from my PhD is design can reduce stress or it can add to it. So if we know that design can reduce stress or add to it, what would we rather do? Okay, so there's our incentive now, the invitation to thriving in the city. And what does that take? What does that look like? To create something that is inherently low cost, so not low value, but it doesn't cost the earth, for a very high impact initiative to create a healthy, health creating society. And this concept of a health creating society is something that we're going to be hearing more of going forward. So Lord Nigel Crisp, the ex-chief exec of the National Health Service in the UK, he just launched a book 2 weeks ago called Health Happens at Home, Hospitals Are for Repairs. And the health systems around the world were overworked prior to COVID. With the advent of COVID, the first major pandemic, okay, we've had SARS, we've had MERS, Ebola, but this has taken the world by surprise in so many ways. And so we now need to be focusing on a health creating society that puts us in a stronger position for the next pandemic that will come down the line. So all the science says that with climate change, we are looking at increasing numbers of pandemics. And so what do we do to boost the collective immunity of society? As designers, we have the knowledge, we have the evidence to put that into effect, which takes us right back to the beginning of the professions in terms of landscape architecture and urban planning. We're firmly focused back at the end of the 19th century and first half of the 20th century on public health. And then with the medicalisation of health, that focus on the environment slipped away, but that's coming back again. So what we know that environmental design can significantly reduce stress. Now, when we use significantly as a scientist, we're talking about statistical significance. And that's when the medical profession, the healthcare profession, sit up and take notice. So this is an objective measure. So through my PhD, I measured salivary stress cortisol. And that's the hormone. Cortisol is a hormone that tests your physiological state. So you may say, I feel fine, but your cortisol will tell us, regardless of how you think you feel, how your body's actually responding to a given moment in time. So we found that through various design interventions, we can statistically significantly reduce chronic stress, which is then linked back to all those lifestyle related diseases. We also found, really surprisingly and happily, that environmental design can be protective. So for those few people in my research group, so we had 164 people that we were working with as a randomized controlled trial, for the few people whose cortisol levels went up even after exposure to the biodiverse, sensory-rich environment, after time in that biodiverse, sensory-rich environment, their perceived well-being went up, even if their cortisol levels had increased. Now, for people who had been, we had a randomized control trial, which means that you have a control group, a formal control that go about life as normal. And then I had a comparative intervention group who spent time in that plaza that we looked at earlier. And then this image here is in a sensory garden that I created, my living laboratory as such, for the study. So people in the plaza, if their cortisol levels had gone up, their well-being went down, which is the normal expectation, that you feel worse because you're more stressed. But to be able to have the protective effect, having been in this biodiverse, sensory-rich space, is fascinating. And that's something that needs to be explored further. So there's a research focus for anybody who's entering into the research journey. Happy to guide, mentor you, supervise your PhD through that further exploration. We also found that healthy, active lifestyles, which are key to public health, and there are all sorts of programs and massive health budgets spent on stopping smoking, anti-obesity, anti-addictive behaviours, getting people moving. All of that happened naturally after time in this biodiverse, sensory-rich space. So that all happens when we get the design right. However, we're dealing within a marketplace that is full of perceptions that become the reality of the holders of those perceptions. But the reality is where we need to be focused, and so that we can then guide people through their perceptions, so it becomes a change management exercise. So it becomes a very gentle sense of taking responsibility, the R of reality, being focused first and foremost on the environment, so that healthy ecology. When we talk about accessibility, we're not just talking about ramps and handrails, we're talking about what does it take to be an accessible space for somebody with mental health accessibility issues or physical health accessibility issues. What is it that these people need? So we've got all the information on that also. That's all written up, that's there in the literature. Cost. Now, it's not so much low cost, and some people get put off by that because they think, hang on, if we are designing something that is based on a percentage fee base, we don't want to go low cost, we want highest cost we possibly can. But it's about value for money and adding value. So we just needed an L there for the reality. So it's that sense of adding value to whatever budget we're dealing with, but knowing that by putting the emphasis on the environment, we're not putting it on the bells and whistles as such. We're not talking about the bronze sculpture in the corner. We're talking about what actually we need to create those health and well-being outcomes from the design. So it needs to be impactful, and how you measure that impact. And is it enough? We'll talk in the next slide around how we measure our impact. And trust. Establishing trust across the stakeholder group is essential. Because if we're going to hold their hand through challenging their perceptions, they've got to trust. They've got to trust the science. They've got to trust the professional who is presenting that science. And we've got to remember that we're dealing with young and old, able and differently abled. We've got an ageing society, but in parts of the world, parts of New Zealand, we've got a very young community. And what does a design intervention for those people look like? And how is that similar, and how does it differ? So trust gets a separate slide all of its own because it is so important. This photo was taken in the forest out the back of University of Berkeley when I was there with Claire Cooper Marcus, which some of you will know. So testing, having the confidence to test yourself, but also to be tested, and creating that relationship with the client, with the stakeholders, to say, we might not get this right first time, but let's test out the ideas. It's part of the sense of trust. Is running a trial and saying, let's do something small here, and if we see the health outcomes and we measure those, we measure their impact, then we can go back and do more. Or we can tweak around the edges if we find that it's not working entirely as expected in some way. Again, it comes back to this responsibility to say, we are, as a profession, designers, we are able to affect public health in a way that very few other professions can, quite so significantly. And that's statistically significantly, clinically significantly, and socially significantly. So it's up to us to utilize that responsibility. An understanding of the wider issues at play. So everything that we do, if we say it's around ecological health, then understanding the flow and effects of that with climate health and human health and well-being. It's all interconnected. And that's that sense of indigenous wisdom that says, we've got this. And that knowledge is there, and it's within all of our communities, but it's just a question of drawing that out. So it becomes a social contract. And then we're treating the people as a taonga. The people are the treasure. So we're not just saying, yes, we've got a space that looks good, but we're actually going back to human-centered design. If we treat the people as a taonga, then we get this sense of what's right for them actually has to be right for the environment as well. So, evidence-based design works on scientific evidence, which then says, how can we objectively evaluate our work? And how do we objectively evaluate the work of others? So we've got things, mechanisms like post-occupancy evaluations. And one of my examiners for my PhD, I don't know if she's part of this Zoom session, was Professor Mardell Shipley, who's the head of School of Landscape of Architecture at Cornell University. And it was a question that she asked me. And my response was, it's very difficult, which is why I did the randomized controlled trial, which is very unusual within the design profession, because it absolutely puts yourself as a design professional out there. It may have been that my design didn't work, that it was a failure. However, that's the science that says, well, a failure is still a result, but being open to that. How do we objectively evaluate our work and the work of others? So that's a key question to store away in the back of your brain. What is evidence? If 3 people say this is what happened to them, does that become evidence? Or do you need 30 people to say that? Or do you need 300 people to say that? Or do you need people from various cultural groups? Do you need people from various climate zones? So how do you build a body of evidence? So we've got a published body of evidence in the academic journals, but are they available? Are they accessible to the average practitioner? Probably not, which is where it becomes more a gut instinct. Look, it's worked here, so we'll do this here. But is that actually working on evidence? No, it's not. And then we've got the question of, okay, so if we put evidence up on a pedestal and say, look, if we are designing for health and well-being, we need to be evidence-based. Medicine is evidence-based because you don't just work on a hunch and we'll try a drug and see what happens. So in this post-COVID world where we are looking at public health interventions, at health promoting interventions to create this healthy, health creating society, where is evidence best applied? In social housing, in healthcare, in education, in retail, in business parks. Perhaps not down the side of a motorway in the middle of a planting revegetation scheme. But in our urban settings, wherever people are nearby, pass by regularly, that's where we need to apply our evidence. So part of my research was to create, well, it wasn't part of my research, but one of my research outputs was to create a new model of health. And so Bronfenbrenner is the author of the sociological model of the determinants of health, and Engels is the author of the eco-biopsychosocial model of health. And both of those models, they talk about the importance of environment as a determinant of health, but nobody was talking about the quality of the environment. And so that was one of the big learnings to come out of my research, which is being published shortly, submitted to the journals last week, in fact, was the sense of the quality of the environment. And it is that biodiverse environment that is the heart of this virtuous cycle of well-being. So the integrated salutogenic design for well-being model captures our ability as designers to connect people socially, to reduce stress, thereby enhance well-being, which then connects them back to nature. The nature connection doesn't happen without that biodiverse environment, and that then fuels the cycle. So what is the role of the designer? So evidence-based links between design, planning principles, and health outcomes. Where do we fit in all of this? Hopefully you're getting a bit of a sense of the answer yourself. And in the chat afterwards, yeah, I'd love to discuss this with you. So the role of the designer. So I have a, yes, here we go. It's on the desk here somewhere. Can we see this? Yeah, so this says Volksheilsarbeiter. And so the World Health Organization gave me this wristband to say that I am a public health worker. So in Norwegian. So we are able to be public health professionals. So it's a new way, well, it's an old way, but it's a new way for us currently of thinking about what we can do and how we can affect change. So I pose the question, is this space healthy or unhealthy? Now, this was one of the biggest surprises of my research. So I had a comparative intervention space. I had an ecologically healthy, sensory rich, biodiverse space. So I kind of figured that this might be less impactful than the other space. But what I wasn't expecting was that this space did measurable harm. And so all the trends across all of the measures, having spent time in this space, in this plaza space, with the trees and the seats, in the open space, in the green background, the same amount of sky, so the same physical space, 900 square meters, was negative. So productivity went down, well-being went down, perceived stress went through the roof. Nature relatedness went down. So people felt less inclined to respond to their environment. They sought out less physical activity. It was fascinating. So the natural and the built environment together, and this is something that we need to address as a profession also. So together, this natural and built environments play a key role in shaping health outcomes. So previously, the lack of causal evidence. So that's that absolute cause and effect. And it's really difficult to prove anything, to prove causality, to say this happened because of that. And so because we couldn't prove it this because of that, it was used to justify the status quo. But with the new data from my study, we've got really rigorous, really robust data now that I believe gives us this responsibility for action. So we now know what does harm and we know what does good. And so it becomes a question of extrapolating that out and applying it. So the solution as such is to create the climate which allows people to thrive. This photo was taken in the workplace and Mum had to bring her child to work for the day. And so by having created a space where Mum could sit and work, so she had a beanbag that she could pick up and move to, so she's actually sitting on the edge of a pond there with a little waterfall beside her. While her son played nearby with 30 centimetres of sand that became an urban beach as such. So he was happy, he was in an environment that was safe, and she was 10 metres from the building, from her office, but she was able to step outside, carry on with her work, and at the same time look after her son. So this is this idea of thriving, which goes beyond simple well-being. And we do this by reducing stress, by connecting people to nature, first of all, and connecting people to people. So creating those spaces for people to come together. So my research was in fact a workplace well-being study, which is why we've got this emphasis on the workplace. So the vision for all of this is to explore the social determinants of health differently, the physical and social spaces. So this photo I took when I was in Paris, and the mayor of Paris, Anne Hidalgo, has a wonderful vision for public health for her community, and had a shortage of public open space, of green space. And so this was down on the periphery, what used to be the major ring road around the city down by the river. And it's been greened, and it's biodiverse, it's sensory rich, it's quiet, it's low cost. But it's this public space that becomes very private space that has nooks and crannies where you can hide yourself away, but you can still see out. You can still be seen, but it's got these spaces of retreat right there in the middle of the city. So this is this exploration of physical and social space. So by enhancing environmental quality, we're going back to the root of the integrated salutogenic model for well-being to create this healthy, health-creating society. So Beat Stress, excuse me, Move More was a project that I worked on, which was as part of a global competition, where we designed in the cause into the solution. So people don't exercise because they're too stressed. So how do you get them to move? Well, you've got to address the cause, the root cause. And so this was what we found, was that by allowing people to rest and restore, they then spontaneously went out and sought more physical activity at whatever level was comfortable for them. Healthy ecology was the key, or part of the key, and the other was the management of the space. Now here we've got long grass in the city. Now for some of my research participants, it was the first time they had seen long grass, because we live in manicured spaces in the city. In fact, in the countryside, it's pretty hard to see long grass in many places also. So that sense of the wild, of the slightly untouched, and seeing what pops up through the grass. Now, this is actually a kikuyu, which is not ideal, I'd have to say, as a meadow grass species, but that was part of the budget constraints. But all sorts of stuff did come up through it in terms of colour and texture. But we had the soft grass that was then at hand height, so that as people walked through, they would brush their hands through the tops of the grass. And then we had mown paths through there. And that was really challenging to a very practical level, on a practical level, to the estates managers. And so that was a vital part of that stakeholder engagement, was to bring them along on the journey, to say, this is what we're doing and why. So having the sense of wild in the city was really important. Which takes us to this co-creation. And so we talk a lot about co-design and co-creation, but it's so much more than just stakeholder engagement. So bringing everybody along on the journey is what ensures this enduring result, this sustainable result. Otherwise, you've got that flash in the pan idea that, you know, the 1 minute wonder. So we don't all hold, none of us can hold all the knowledge. And so if you are in doubt at any stage, don't be afraid to call in an expert. And that's what I have loved throughout my research process and my professional practice, is meeting people, meeting experts and saying, hey, look, I'm working on this. I've got this idea, but I've never done it before. Would you be prepared to help me to share? And people are so willing to share. And then we create this network of like-minded individuals who are working altruistically for the greater good of the profession and for society. So salutogenic urban design, salutogenesis comes back to this health creating, health promoting. So if we think in terms of wildlife corridors and how we've got a conception of what a wildlife corridor might look like across a city or across a town, we need to be thinking of how we put people into this sense of moving people through our cities, through our communities. When I was putting these slides together, I couldn't find the slide that I was looking for that actually had a cycle route through under the trees. But anyway, you get the idea that it's about what's good for the wildlife is good for the people. And we need this connection. So as we said, we were talking about connecting people to nature and people to people, but it's also that connection between the built and the natural environments. And so that's working right from the get-go on a new project with the project architects to say, where are people going to come from? What's their view out going to be? So that landscape's not the afterthought, but it is front of mind to create that health promoting experience that says, what do we need? And it is that green view, and it is that access, ready access to, so that when you need to take a break, going back to the workplace wellbeing, you can just pop outside, breathe the fresh air, go back inside again. Excuse me. So creating those access points. So we need to be there, having those conversations early on. And we can do that when mandated with providing health promotion outcomes. So spaces fundamentally need to be engaging and enabling. The photo on the left here is in Berlin. And this is a little roadside verge where in many cities around New Zealand at the moment, little rain gardens are going in. Well, rather than having a rain garden, the residents here, so everybody's living in an apartment above street level. So street level, we've got shops, retail, light manufacturing, and then residential above. And so one of the residents claimed this space, put a little picket fence around it and said, this is mine. And the city let her, allowed her to claim the space. And so there's a little seat in this space. She's got an arbour there. She's got bird feeders. So this is her space in the middle of the busy city on the side of the footpath. And as we move to urban densification, and we need to build in, design in health and wellbeing outcomes, we've got to be thinking in terms of that sense of ownership of a space and allowing that and how we affect that through design. Do we just leave it and let the people create their own environment? Or do we work with them and say, hey, anybody here in this building like to do something? Here's our opportunity. We've got this much money left over as our budget, having done the street works. So those are conversations to be had. Photo on the right was in a social housing development, and there was a bit of a porch out the front, and you can just see in the middle here a steel pipe. So it was a very basic steel, galvanized steel support post for this veranda. It was sort of grey and ugly. And so what we did was we just framed it up very simply, and so that we could grow fragrant vines up there, put in our spring bulbs, and now there's this sense of beauty and pride, and this little darling comes out here and she waters her babies on a daily basis. And so it's that enabling people to interact with their environment where they are on a daily basis through very simple interventions. So we started with a picture of sheep and the sense that the environment is important for health and well-being. And it's not just the urban environment. And so I wanted to just acknowledge that rural environments impact health and well-being equally. And our property, we've got a rural property in Canterbury in New Zealand, which is in so many ways idyllic, but so many people in the community are being diagnosed with cancer. And that's another piece of research that I'm going to be interested in, is looking at the influence of agri-chemicals and incidence of cancer. So what we do know is that what is good for plants and animals is good for humans and vice versa. So we've got to concentrate firstly on healthy soil. And this is in the middle of the heart of the city as much as it is out on a farm. It's about water, water quality, water availability, and then managing to store excess as it falls out of the sky. It's about trees. We need trees wherever we are. Lots of them. short ones, tall ones, wide ones, broad canopy, columnar shape, fastigated varieties, the whole package deal. We need to be providing shelter, so that's shade, that's from rain. We need to provide cover, that sense of security where you can hunker down. And we need that in rural areas as much as we do in the city. So we're working on a project doing exactly this sort of thing in a rural school at the moment out the back of Whanganui, which will create all these spaces for these kids in an otherwise flat environment, which was much like the campus picture in the first slide. So thank you very much for joining us this morning, and may you go forth and scatter the new knowledge, spread it widely, and yeah, please feel free to get in touch. So with the PhD, I'm now qualified as a community health consultant, salutogenic urban design. So what we've done as a practice for a long time is work with councils, with developers, with fellow design professionals to design, advise, and we also do the full service design from consultancy through. So the UK practice is the mother company as such, and we've got a small office in New Zealand as well. So we work globally. We worked remotely from the get-go, which was a bit of a bonus when COVID came along, and so I'm now in New Zealand, which is a great place to be locked down, and the design team in the UK, they get on and do their thing. So please do feel free to get in touch. But now, yeah, please, yeah, ask any questions that you fancy.
Thank you, Gayle, for that very inspiring lecture. They are all topics very dear to me, and it's great that to see the work you are doing to really bridge the gap between design disciplines and health disciplines. Before opening the floor and allowing people to to formulate their questions, I think my question is in relation to the design professions, into landscape architecture overall. What are the changes that you foresee in our daily practices that need to happen to accommodate all this information that you just gave us around health and well-being?
I think we need to open up the information channels so that it's all very well, sort of having all this knowledge, but being able to put the knowledge into action is what's absolutely vital. And that was something that was very evident working through things like literature reviews within my research, was to say, okay, so we know all this stuff, so why is it not happening? So that's a project that I'm working on at the moment. We've got a funding grant in to actually put knowledge into action. So we need, not as an academic, but as a practitioner, to be seeking out new information. And so that then puts a responsibility on the publishers to make that information available. And so many of the journals are now open access. But I guess part of that, what changes on a daily basis then, is to have that curiosity as a design practice to say, where else could I look? I'm not finding what I'm looking for here. I wonder if it's over there. And I think that was probably what I did differently early on, like in the early 2000s, was we had clients who might have had a particular health condition, and we had to go and research, and there was no sort of information available within landscape journals, but we found something specifically in a health journal or an ecology journal, and then triangulating all that information, bringing it all together, integrating it all.
I think yeah, I'm totally with you. Like, I also experienced that in my job. Like, sometimes what you find is very much valuable information, especially in health disciplines, and they just don't know what to do with it because they are not designers, and we are the designers, but we sometimes don't have the time, especially in practice. You don't really have the time to do more thorough research. So yeah, it's
that to jump in is where it's part of that education and creating that trust with the client to say, if you want to achieve these outcomes, it's going to take some time because I'm going to need to do some research. And just
absolutely.
building that in and saying no to a job seems sort of inherently wrong on so many levels, but we've got to be realistic and say, this is what's important, this is what's at stake, and this is what's going to be involved. And it might take me another week to pull this information together to put us in a position to inform the design brief. Because the clients only know what they know. They don't know the potential. So we've got a massive education program that's needed to affect this change across communities everywhere.
Totally. Opening the floor to other questions from our participants. Don't forget to unmute yourself before starting. I don't know, Gayle, if you have been reading the chat box, but there's very positive comments. We have Rosalind saying, best urban design architecture webinar for a very long time.
Thank you, Rosalind.
Emily saying, that was fascinating, very inspiring. And we have Philippe just saying, as designers, our power is the power of influence. COVID crisis has revealed that the focus on efficiency from health to education is counter to resilience.
So, Philippe, that's a really good point. And so resilience is all about building up that sense of self. And what we found with our research and as a practice, so we've had all this anecdotal evidence, which I guess is what prompted me to then formalize that anecdotal evidence through the PhD process, was people were telling us, clients were telling us that they felt better in and of themselves and function better. And that was across the demographic, age and ability wise and culture. So to be able to build this resilience in through creating that environmental resilience is just, it's a beautiful synergistic sort of an opportunity. And it is this opportunity that I firmly believe we've got to seize, or otherwise the engineers will take over and we'll be somewhat obsolete. Because there are some fabulous environmental engineers around and they are doing great things, but they haven't got that detailed knowledge of things like planting plans, you know, the most basic things that we can fundamentally change the feeling of a space through something as simple as choosing plant A as over plant B.
Gayle, any final remarks? What's next for you?
What's next for me is I had hoped to have a holiday, having finished. I finished my PhD the last week of lockdown, and so did my oral defence. And my examiners were, as I mentioned, the head of School of Architecture at Cornell University and the head of Public Health at Auckland University of Technology. And so it was a rigorous process, let me tell you. And so having done a multidisciplinary PhD, which is unusual in and of itself, so landscape architecture, health and ecology. So to pull those threads together, was busy. But what we're doing now is we're putting that into action, and people have been emailing and on the phone saying, okay, what can we do? So we've got city councils saying, we need urban densification, but we need to design in health wellbeing at the same time. How do we do this? So what's next is seeing where this goes. So to be able to affect change, to share this, to do more lectures like this, to spread the word. I think I'll need to write another book. So Routledge Press, my editor's saying, okay, right, let's work on this. And so I've written 3-4 book chapters while I was doing the PhD. So there's some stuff coming out that will share some more of this that will be generally published. But it is about getting, the next step is about getting this information out there and putting it into practice.
Yeah. Best time ever.
Oh, look, absolutely. It's great. It's a lot of fun. It's a lot of fun.
I think like it's also interesting, and hopefully you have, you know, a time to explore that as well. It's really also to share with the world how much we can learn from our Indigenous culture in New Zealand.
Absolutely.
And especially around health and well-being, because it's such a different understanding in comparison to the Western understanding of health and well-being.
And it is that holistic sense of bringing it all together that,
I think it's beautiful.
It is. Yeah. It's effective, what's more. And
Exactly.
it's that sort of intuitive knowledge that we've known forever, that gardens, that nature, landscape is health promoting, is supportive of us, but we kind of lost that along the way.
Absolutely.
So to bring that back in, it's a beautiful thing.
Thank you very much for such an inspiring morning, at least here in New Zealand. I'm sure that people that are across the globe, and it's evening for them, is going to sit with them for a little while before going to sleep. I think for us was a great way to start the morning. Such an engaging lecture and mentally stimulating. Thank you for that, and I wish you all the best now with all the different projects that keep you all very busy, and good luck with all the writings, and I hope that I can see you face to face in the near future.
That's good. Look forward to it.
Yeah, exactly. And thank you everyone for attending, whatever you are based here in New Zealand or across the globe. Thank you very much for attending our Thinkers and Doers lecture. I wish you all the best, and I hope to see you in 2 weeks from now.
Great. Thanks, Bruno. Thanks, everybody. Bye-bye.
Bye.
Bye.